Hello.
Hey,
Nice
Scarlett
to
and Michelle.
nice to see you folks. So, welcome to September. I don't know how this year has already flown by so fast. I'm Angie Hacker. I know you all, I think, by now, but we're gonna give it a minute or two for more people to stream in. I don't know about you, but my summer quickly transitioned to fall immediately, from fun to school, sick kids, and yeah, a lot of extracurriculars. So that's what's up for me. How's everybody doing? I don't think we're gonna get Shasta with us today, which is unfortunate, but she's about as busy as you can imagine a human being. Okay.
Hey, Chris.
Well, let's
Hey, Isabel.
Howdy.
we Hi there. We have a few new friends with us today and some old friends. Let's go ahead and dive into what we're here to do together today. So again, I'm Angie Hacker. I'm with the Tribal Climate Health Project. We've been around for 9 years or so. We're under the Palabana Mission Indians, primarily funded by the BIA and some other sources. This has been a group that we had. This is our 33rd meeting, apparently. We meet every other month at this point, and we like to connect national health and climate data experts and invite you to exchange knowledge on priority tribal adaptation and resilience data needs. We will often share tools, practices, ideas, and lessons learned from the field related to tribal resilience data access. And we like to explore opportunities to develop and scale up solutions to address tribal resilience data needs. So today we'll kind of do our usual standing agenda. We will take a moment to do some introductions. And if you, so all should include yourself in the chat, introduce yourself over chat so everybody knows who's who. And I know we have quite a few people from Tracking California here today. I think I will hold you all to introduce yourself under your presentation, which is going to happen after member announcements and updates, which we have the executive director, who you might remember was also HHS, was doing work on climate with HHS, and he's presented in that role, and now is with Tracking California. So we're lucky here in California, and we're going to get a presentation from them about some of the data development work that they are doing for tribes. So that will be the primary conversation today. And then it looks like we'll have a little discussion on tribal data gaps and some of the work the Tribal Climate Health Project is doing, some of our next steps in our work plan. Okay, hi Shasta. Welcome. We're just getting going here. So folks are introducing themselves in the chat. Is there anybody that's new here that's not with Tracking California? We always like to haze our newbies and just make sure that everybody knows who's who.
Hi. Yes, I'm a new attendee and I'm with the County of San Diego. I manage the flood control district, and Isabel told me about this meeting, and I was hoping I could listen in and see if uh, there's anything I can add. I'm sure there's a lot I can learn. Thank you.
Yes, thank you. Glad you're here.
Oh, I just wanted to say I was going to update. Hi, Sarah. That this is the county has the new tribal community of practice. Sarah probably knows more about it, but generally it's bringing together of different departments, units, etc., all of whom somehow interact with, provide help to the tribal communities. So yes,
Oh, that's cool.
yeah.
How come I don't know about that?
You worked with a number of the people because everybody said, "Oh yeah, Shasta, yeah, she's awesome." So
Well, that's great, but tell me more.
Sarah, do you have any more detail on it you might want to talk about? You've been involved for at least a week or two longer than me.
Sorry, I was wrestling with my Zoom here. You're asking me to talk about the tribal community of practice
Yes,
group?
just
Oh, yeah. So San Diego County is an enterprise of over 20,000 employees, and there are many different departments that interact with tribal nations. And the purpose of this group was to bring together the departments that do so that we could learn from each other what would be the respectful and appropriate ways to interact with the tribal nations. Um, the two women who are leading our team are tribal liaisons, and they're both registered members of tribes. So they bring a perspective that's very helpful to the group. But I would say that the groups involved, there's usually about 30 or 40 people in these meetings, and they tend to be director level or assistant director or chief. They're kind of executive management level in public health. Well, we're flood control Department of Public Works. We have the Parks Department. Isabel, if there are other groups, but it's groups from all over the enterprise. So that helped.
Thank you, Sarah. So we haven't met. I'm Shasta Gon. I'm the Environmental Director and Tribal Historic Preservation Officer for the Paula Band of Mission Indians, and
Nice to
I
meet
guess
you.
basically the director of TCHP, even though Angie and Lori do all the work. But yeah, that's interesting to hear. I'll assume that one of your tribal liaisons is Roberta Leash.
Yes.
Okay. I don't. Oh, Luz Alejos. Thank you,
Luz,
Isabel.
that's right. Luz, yeah.
So who I don't know Luz, but is this an internal thing for just the department and staff at the county?
Yeah. This
Okay.
is internal to the enterprise.
Okay.
We have had some speakers, some external speakers address the group when we've talked about issues related to like sovereignty and law and things like that. But it's an
Great.
internal working group.
Okay. Well, yeah, I'll talk to Roberta because I know she's good at wrangling people to come and talk. But this is the sort of thing I love to do. I'm not a tribal member myself, so I know what it's like to come into those spaces and have to learn about it and trip all over yourself and say dumb things without knowing that they're dumb until somebody's like, "That's kind of dumb." So I'm the one who's here to tell you that how to learn from my 20 years of experience working for a tribe. So yeah, I'm glad you're here. Isabel, thanks for inviting her. This is great.
And that sounds like it could be an interesting best practice at some point to share in terms of a county doing work this way and engaging tribes. And I imagine part of the goal there being to get them access to some good information that they can use, which is what they're all about.
I just had another update, and that we've just posted our update to our tribal health and well-being dashboard and our brief. So it links to that. I can drop these very specific ones in there too, the actual brief and the dashboard, so that you can look at it.
Well, you know what? Let's go over to our next slide on member updates because I think we're there, but I know we do have. I wondered if Christy, do you want to introduce yourself? I think this is your first meeting. Christina Cruz. She might be away.
Can you see me?
Oh,
Can you hear me?
I can hear you. Oh,
Okay.
yes, hi.
Okay, we're in office, so I just wanted to make sure. Sometimes my connection is rough. Yeah, I'm Christina Cruz. I'm the Tribal Climate Program and Policy Specialist for the Office of Health Equity in the state. And our tribal liaison for CDPH is my immediate deputy director. We have 3 funded tribes where they're just doing hazard mitigation. Paula's one of them, or vulnerability needs assessment. And Paula's been a pleasure to work with, Shasta and her team. And then providing TA anywhere we can or funding opportunities across the state to tribes and local tribal serving organizations and clinics.
Thanks, Christina.
Yeah.
All right, well, so we'll move into this part of our meeting, which I feel like we're already partway through. Nope, last one where we're just going to ask folks who have any member updates to share any relevant information that might be sort of news you can use if you are somebody who is a person interested in helping tribes access data for climate and climate resilience related decision making. So you might have an opportunity that you're working on, a best practice, a question for the group, some opportunity for us to influence or comment on something that's happening. What do you know from around state or around the country? And let us know, because I've got a few updates, but I want to let some space happen here first. Jesse, you always have some news.
I can make shit up. Nope.
Mhm.
A couple things. Just something that's on my mind, which is the release yesterday of the latest "Make America Healthy Again" report, and I'll let my air quotes speak for my skepticism. But I want to take a look through that and see if there's any implications for some of the work we're doing. I know you can't talk about climate change in the federal government space, but if anybody has any insights on that report and how it might implicate data for our use for identifying climate vulnerabilities, I would like to hear it. But other than that, I don't really have anything to add. Yeah, Sarah.
This is not new information, but it might be new to this group. So the county has a flood warning network, and we collaborate with Pala, Pama, Rincon, La Jolla tribes. We built a flood forecast model for this area after the Pumacha fires, but we have historical and real-time rainfall and stream gauge data information. So it's available on the webpage to the public. And I think we've shared this with the tribes. I think there's been a lot of turnover in staff. We're certainly happy to give a presentation or so. But the reason why I bring it up is that we use this data to apply for grants, to do climate resilience related work. And what we're mostly looking through the lens of flood or flash flooding, but we're also interested in fire and extreme weather events. So I guess what I'm saying is we have a lot of data, historical and real time. We collaborate very closely with the National Weather Service and with NOAA and with some of our tribal partners. We would love to collaborate more with tribes outside of the San Luis Rey watershed who we haven't really been able to connect with. And we do collaborate with our Mexican counterparts through the International Boundary Water Commission because some of our gauges in the Tijuana River Valley watershed are on the Mexican side of the border.
Thank you for that. Yeah, and it's been great to collaborate with the county on our flood warning system and our gauges on tribal lands. And like I think we have one at Palma Creek, and we have some on the SLR. What I would love to see too, since this data work group is open to everybody in the country, basically, is how did you get that started in San Diego, and what best practices do you have at the county that could maybe apply to other counties and their flood control management, or even nationwide? Because that's the thing we find, is that a lot of times the tribes just don't have access because nobody's thought about what the tribes could need, or collaborating with them because they don't know how to work with tribes and they're afraid to do it. And so would love to see some advice for people on that.
For sure. We'd be happy to, we have presentations that we've shared with the I think it's called the Southern California Tribal Chairman's.
Yes, SCTCA. Yeah.
Yeah. So we've presented to them in the past. We've presented in different forms. We'd be happy to share a presentation on the Alert Flood Warning Network and also kind of on lessons learned. You just let us know when you want a presentation, we can give it. I'll tell you the biggest elimination of the obstacle to do that was our own board changing. Our board of supervisors adopted a pretty significant policy change several years back that actually encouraged teams to work with the tribes, and that was not the previous board's position. Having said that, we did this work under the previous board, and we lost a lot of time fighting internally to get permission to talk to the tribes, but that's an older time and we're beyond that now.
It's terrific. Thank you, Sarah.
Sure.
I'm thinking about you. It may be an opportunity to come and participate in our summit that's coming up on disaster resilience. If you have good data, maybe you'd be able to present on what you've got. There's going to be a lot of the SCTCA tribes there, we assume. So we should talk afterwards. Thanks for the update.
Yeah,
Shubhayu.
bookmark November 4th. November 4th at Paula.
Shubhayu.
Just a quick follow-up for Sarah. Sarah, has this information ever been used to look at health facilities and how they might be impacted by these floods? Both facilities within tribal areas as well as those outside, because there's probably a lot of healthcare facility use by tribal people which are in non-tribal lands as well.
Absolutely. Yeah. I can talk about how the county and our other partners like cities, and I assume that the tribes use the information in this way. But we developed a flood forecast model for the San Luis Rey watershed. And when we built the model, we talked with the tribes and we said, what would be important points in the watershed along the river to understand, what the flood, like how high the water is going to get for a certain storm, event. So they gave us the bridges, the roads, the locations, and we incorporated our own. We actually also developed flood forecast model for San Diego River watershed, but not with tribal partners. And so they have access to these forecast points. But in addition, there are people who use our alert flood warning data, the historical data, and for looking at evaluating sort of the resilience of structures in flood prone areas in this watershed. But we also, a frequent user of our data are the co-permittees. Then forgive me if, we have a San Diego Regional Water Quality Control Permit. So it's related to water quality as opposed to quantity, which is what my team works with. But they use this data to develop or to analyze TMDLs or, different types of studies for water quality purposes. So yeah, a lot of people use this data for exactly what you're suggesting.
Thank you. I'm so glad you're here, Sarah. You're going to be a wealth of information and ideas. Does anybody else have an announcement or anything they'd like to share before I roll through a few things? Okay, so I've put a link to our summit there in the chat. It's on November 4th. Like I mentioned, it's going to be this will be our 4th one of these, and we've been on a trajectory all the way from vulnerability assessments. Now we're in it, it's reality, and there are sometimes going to be major events that we need to respond to. So we're going to be focused on climate events as disaster and how to respond, recover, and be resilient. That's the topic of that. It's going to be a 1-day this time, and it will be at the Palabana Mission Indians at their conference venue. And so it's mainly for tribal serving professionals, a lot of the folks that are like Shasta working inside of environmental departments at a tribe. But as we're working through our agenda, we may be reaching out to folks like you if there's a need for speakers or experts on certain topics that would be valuable to those tribes that are coming. This year, it's going to be specific to a California audience and a little bit smaller than it has been in the past. So that's that. There's always data relationships there, but that one is sort of more action oriented. Policy related stuff, I don't know about you, but I've heard some of our friends and folks at the CDC have actually returned back to their position. We're not getting federal folks on these calls like we used to for a lot of reasons, but I'm glad to see they are back. I don't know how much work they're able to do. Obviously, things are happening at CDC that are difficult, and that flows down to the BRACE program, and that flows down to I think even impacts at CDPH probably. So you all know that better than I do. I'm also tracking the end of the legislative session, and you might be too. And so today is everybody's wildly trying to figure out what the legislators just dropped here in California on things like Prop 4, Greenhouse Gas Reduction Fund, and a lot of other things. And I know Chris is on the call here. I don't know if you're tracking for what that might mean for agencies in California. I'm not sure that there's much there for data access, but there's a whole lot there through Prop 4 for resilience activities, and a lot of it dedicated to tribes in theory. So I think we're going to start seeing some funding sources come through in support of tribal climate resilience, and a lot of it in water. So we'll be looking at that to see what kind of opportunities come up that might be information service related. Wanted to also share that we have been running our TechX webinar series. So that has been every other month. We just did one in September. The Tribal Climate Health Project is doing a breakout on tribal resilience sort of in difficult times. And the focus of that has been on looking at adjacent fields for opportunities to continue to do the work on climate resilience, even though it's a challenge to do it through the rubric of climate change. So we're looking at energy and water and transportation, infrastructure, environmental protection, land stewardship, air and water. How do we continue this work without really saying climate change is kind of the point. And then I think in our next meeting, we're going to talk about we're going to dedicate it all to tribal climate health project stuff because we have some stuff to share with you. We have a paper that we have produced in collaboration with NOAA, which was based on interviews with our tribal advisors. It's talking about data gaps, which I think is totally relevant and really should be presented to this group. So once it's in print, and ideally it's going to go into a journal somewhere, we can present that here, and I think that will be a good one for next time. We also will want to share with you I don't know what stage it will be in at that point, but we've been working with a CEC grant with the Public Health Institute on our EASY tool for extreme heat. That should be ready for you to kind of work your way through and take a look at it. And the last thing we want to make room for in these meetings, maybe on an ongoing basis, is this effort that we're about to launch with grant funding on better understanding the status of wildfire health and water supply data. And so we're looking for folks like you who might be able to inform, give us some expertise, tell us what rocks to look under about where this data is actually made accessible to tribes, where is the best data. And if you're really interested and this falls within your, funded work to help us with that kind of analysis, we would love that. So we'll talk more about that the next time. But those are some of the things on our agenda. Anyone else have any other announcements before we move into our main discussion? All right, thank you. All right, let's move to our next slide. And Lori, I'm gonna leave it to you.
I'm excited for this presentation by Dr. Saha and his team at Tracking California. They have, if you don't use the tools at Tracking California, you should, trackingcalifornia.org. They're not only are their tools good, they have tools on PFAS, pesticide, other data, health data. It's one of the few places that I've used that when I have trouble with a tool or I have a question, somebody will actually get back to me, which I feel like is an amazing thing with any tool. So I'll stop screen sharing and let Dr. Saha take this away. Thank you.
Thank you so much, Laurie. That's very kind of you. You will mostly hear from my colleagues within the Tracking California program. It's been about 2 months that I joined the program as the director, and I was with the CDC's Climate and Health program. The BRACE program, as you refer to it, have been with the program ever since its foundation. Given everything that's happening currently in the federal system, I just feel so grateful to be part of this program, to be able to continue all the work that we collectively have done, over the last decade and a half around, climate justice, around resilience, around mainstreaming climate change into, policy discussions, at the state level, at the federal level, at the local level. And, I really consider this program to be unique for 2 reasons. One, I think, as a program, we were the pioneers in terms of, creating these integrated environmental monitoring, climate change, health surveillance information systems, dashboards, data systems, and such, where we were bringing in health surveillance information with the partnerships that we had with the California Departments of Health, and then, environmental information from a host of other sources. We've been doing this for the last 2 decades, for the state of California. And over the last, I would say 8 to 10 years, the group has, the program has sort of organically evolved into using some of this information to really drive action at the community level. We have, deep standing relationships with multiple communities across the state, north, central, and south, where, most of the work is essentially happening conjunction, in communication with the communities, to actually do implementation of, climate related risk reduction strategies, resilience hubs, cooling shelters, trying to find out what these local risks are from lithium mining, in the south and such. And so we really see ourselves at that sort of intersection where we can actually translate some of the data and science into practice, working very strongly with the communities, empowering them to do this work, moving ahead. And I think we would love to work with you and seek your guidance and partnership as we try to develop that work in tribal communities and rural communities. So with that, I'll hand it over to colleagues who would specifically talk about some of the data initiatives and some of the the community driven programs that I talked about. So over to you, Jackie.
Thank you, Shubhayu. And so I will be kind of getting us started, and let me advance our slides here to first kind of talk about some of our core surveillance work that Shubhayu kind of mentioned that we conduct in partnership with the Department of Public Health. And then Michelle, my colleague, will follow up with talking to you about some of our climate and health projects. So I'm going to go ahead and advance. So I think you guys are pretty all familiar with CDC's Environmental Tracking Network. Tracking California is part of that national network, and a central part of our role is to really collaborate with and serve as a resource to state agencies, local health departments, and community partners. So today I'll kind of touch on a few of the key activities supported by that grant, which includes the Data Explorer and some of our tool development efforts. Over the years, we've really developed tools where we have identified important data gaps and needs. And so I will start by briefly highlighting a couple of the newer or more kind of active ones. So the first one is this traffic tool, which really is kind of a one-of-a-kind tool here in California or anywhere. I don't know that there is another data set like it, which you're able to look at just traffic volume, and that is really connected to air pollution and noise pollution as well. Our pesticide mapping tool, which has been going for a while, allows you to view kind of pesticide application data down to the square mile. It's grouped by pesticide type and category, but I think more importantly, although this is a public-facing, user-friendly tool, behind the scenes, we also use that tool by request to kind of map pesticide use in relation to other important or sensitive locations. For instance, like how close is pesticide use being applied in your private wells, near schools, or other kind of areas that are at risk of being contaminated. And we're able to kind of overlay that with health data as well to be able to see what are the potential impacts for that. And lastly, we have a water quality viewer that we're going to be updating fairly soon and hope to have ready by the end of the year. Also, another easy to use kind of public facing tool that allows you to look at, I think it's 8 contaminants found in public water systems across the state. And we have data going back quite a few years, maybe over 15 years. So we'll be updating that and hopefully have that done by the end of the year. So I'm going to talk to you now about our Data Explorer. These are kind of just a listing of all of the measures that all of the CDC tracking states also produce to some degree. Not all states are able to do it at the same geography, at the same categories, but generally kind of this is a listing of all the data metrics that will be in our Data Explorer, and kind of I'll talk to you about in a second. So our Data Explorer is hopefully pretty easy to use. You're able to search by topics, and you're able to interact with the data using the maps, the charts, tables, and trends, and I'll do a quick walkthrough in a second. We also have a Spanish version of the Data Explorer, so you're able to look at the query in Spanish, and you could do a little toggle at the bottom. I think as we kind of do the walkthrough and hopefully discussion later on, we want to use this as it should serve as a starting place to be able to ask more specific questions of the data. And so why don't we go ahead and take a second and see if this will work. If I do the walkthrough, let me know if it's not. Okay, I think it does. So if you click on the link and you go to our site, you'll land on this page, which has, walks you through all the various features of the Data Explorer, where to find, how to change, whether you want to download a chart, whether you want to learn more about how the data is calculated. And there's also a user guide that's a PDF, so you could just use it that way as well. If you go into the Explore the Data, you're able to, again, look by topic. Asthma is here, so you can either look at hospitalizations, mortality, emergency department visits, and we have various subgroups that you can do by various age groups, sex, race, year, and counties. You can do it by county You can look at the time trends. You could also select if you're interested in a specific county. We could, I don't know, do Lake County. See that compared to the California rate as well. You can select as many counties as you want for that. I'm going to unselect it because right now. Additionally, you can have two different kind of views. So you can look at the map and the table or the chart or the time trend. So there's a lot of options here for how to be able to use the data. And we do have some metrics that are available at zip code and census tract level. The census tract is mainly for maternal and infant health indicators. So I hope you guys will explore that at some point. But really kind of some of what we wanted to highlight is, as I mentioned, the Data Explorer is kind of meant as a starting place to ask questions. We're really limited in what we can show on the Data Explorer because of sample sizes. We could only show things that are above 11. So often there will be suppressed data for a specific region or by a specific race ethnicity. But, we do have access to all the underlying health data that populate our Data Explorer. So emergency department data, hospitalization data, all-cause mortality, birth data for California. So while we can show some things public facing, we do often work with partners or in certain projects to be able to look a little bit deeper into the data. So we're able to look at different health conditions by various ICD codes, could think about how to regroup various race ethnicities, for instance, pulling out American Indian, Alaska Native from right now, currently they're often combined with Hispanic Latino or multi-race if they select other races. So being able to pull out anyone that has any indication of American Indian, Alaska Native, be able to see, you know, more data will be available. It won't be as suppressed. You're able to see better patterns, create new geographic groupings based on zip codes of interest, or potentially apply kind of new geographic boundaries, whether there's a tribal boundary or some other specific region that you're interested in. So those are kind of some of the underlying things that we're able to do currently, but also just thinking forward about what are some of the needs going forward, as our tracking grant may or may not be renewed for future years, like how can we build out this data explorer? What are the needs that are present in the community that we should be thinking about considering what data we have available and what, experience we have? And so as an example of how this data is used within some of our other work, this is going to connect it to a project that we're going to be talking about in a little bit. So this is how we use some of the data from our Explorer with our partners a year and a half ago as the project was getting off the ground. Partnered with the Big Valley Band of Pomo Indians in Lake County. We shared this graph taken from the Data Explorer of heat-related illness ED visits with the working group of CHARM. You can see that ED visits in Lake County are more than twice the state average, and that the highest peak line up with years like 2017 and 2021, which were also two of the hottest summers in the past 20 years in Lake County. This was kind of important for grounding the discussions in location-specific data and showing how climate and health connect locally. And CHARM is a project partnered with tribes and other community organizations in rural Northern California, which Michelle will talk about in detail shortly. But I see that Sarah has a question, so I can ask her that now if you want to.
Do you mind taking the question now, or do you want me to hold it till the end?
I don't mind taking the question now, but will leave it up to Lori and team to let me know if I should hold it to
Go
them.
for it, Sarah.
All right.
It's a question about this slide. So
Yeah.
this is very cool, first of all. I'm sure you know that. My question is, of course, I'm thinking like an engineer because that's what I am. It'd be really fascinating for the counties to see what their temperature, the average temperature of those months, how it deviates from, well, there's a huge temperature range, and we would expect heat illnesses to be greater in counties where the heat is higher as opposed to like coastal San Diego, for example. I wonder if there's some way to visualize. Well, I don't know what we would compare it to, but I guess how the average temperature of this county during those months compares with the other counties, for example, because I think we would expect more heat illnesses in, I mean, just looking at San Diego County, just looking at our East County, we'd expect more heat illnesses as compared to like La Jolla, or, that's right on the coast.
No, I
So
think, yeah, some of
yeah.
that has come up repeatedly of just like how to overlay and bring in some of the more environmental data to be able to, visualize with our health data. That is, I mean, something ideally we'd love to be able to do in the future, but on a specific, data request or project specific basis, that's definitely something that can be done. And I think it's a great idea. I'm gonna pass it on to Michelle to talk about some of the specific projects that we're working on.
Great. And I'm standing in for Scarlett, who's just not doing well today. So I'm just gonna go through her slides. And Lori, what time would you like us to wrap up, just so I have a sense of how much time you want to have for just Q&A and
You
such?
guys could wrap up like, 10 till, that'd be great, so that people have time for questions, answers, and other things. If not, that's fine too.
Okay. Great. All right. So, hi, I'm Michelle Wong. I am the Health Communications Director at Tracking California, and I am co-PI on a couple of the projects that we're going to share. So, in addition to, as Shubhayu mentioned, in addition to some of our surveillance programs, Tracking California works on a number of community engaged and community partnered projects, which often either utilize and or produce data with the goal of really improving public health and the environment in those communities. So in that context, I'm going to be sharing a little bit about our collaborations with tribes specifically. And these really began through a connection and eventual partnership with Big Valley Band of Pomo Indians up in Lake County around the issue of harmful algal blooms. This began about 11 years ago with Susan Poliakonis, who's on this call. When from our team reached out to Sarah Ryan, who is the environmental director at Big Valley, and who's been like a leader in Lake County and the state national level relating to HABs and water quality. And so through this, kind of organic process, our work has really expanded to include collaboration on projects with other tribes in the region and expanding from water quality to other climate related issues like air quality and extreme health or heat, sorry. Next slide. And this is just some pictures from a recent visit to Clear Lake for the Tule Boat Festival, and that's Sarah and Susan on the bottom there. Next slide. So I'm going to talk about three of our sort of climate, environmental, and health projects. The first one will be CalWatch. Can you skip the next two slides? Perfect. So harmful algal blooms, also known as cyanobacterial blooms, have been increasing in Clear Lake in Lake County for over the last, say, 15 years, really threatening the drinking water supply as well as recreational and cultural uses of the lake. Of over 60% of Lake County residents receive drinking water from the lake, but many of the sort of self-supplied drinking water systems are not tested or treated for toxins from the algal blooms or nitrates, coliform bacteria, or other contaminants. So the CalWatch study aims to track and prevent harmful algal bloom illness and to improve outreach, illness reporting, and drinking water monitoring in Lake County. And Susan, please jump in. Susan is the PI of this project. So some highlights from that project. So Big Valley had been testing HABs at the lake prior to this project and really leading the county in paying attention to this issue. And so this project helped to continue and expand some of that testing work. Through this, the project has tested for free residential drinking water from homes that draw their water directly from the lake and nearby streams and creeks, and also reporting back the testing results to the residents with information about filtration and treatment. Here you'll see a press release that testing through CalWatch found high levels of cyanotoxins in the lake, and so the project was able to notify the county to put out an alert and also worked with local water systems to be able to provide emergency drinking water to those impacted homes. And Big Valley continues to provide outreach and education about HABs through workshops, Facebook page, Sarah's radio show, website, tabling, etc. Next slide. And so this year, maybe beginning from last year, but moving forward for this last year of the project, they're really expanding their investigation beyond nitrates, bacteria, and cyanotoxins, and are really interested in testing drinking water from wells that may be contaminated. So here you see a map that Catherine from our team created using existing data layers to look at residents whose wells may be at risk from potentially contaminating activities like cleanup sites, septic tanks, nitrates, pesticides, or within a flood hazard zone. And so that from that I think the team is going to begin or has begun recruiting at homes near those that are going to be maybe the most impacted, and then offering testing and follow-up. There's also a component of this project that's really interested in tracking and better tracking the health impacts of HABs, which are difficult to track. So the team analyzed ER and hospitalization data for Lake County during heavy bloom activities, and really focusing on diagnoses that are likely tied to exposure, including skin conditions, stomach issues, and asthma and allergic reactions. And I believe that the plan is to expand the analysis to look at Medi-Cal data. So that's just a quick overview of the CalWatch program or project. Next, I will talk about our MLS Triad project. So next slide. So this is the Mendocino Lake and Sonoma County Tribal Initiative on Air Quality and Drought. So this project I sort of inherited, but which is fine. It was a proposal that was co-developed with tribal partners at Big Valley, Middletown, and Sherwood Valley to address some of their climate resilience priorities. It was funded by what used to be the Office of Planning, OPR, but now is California Governor's Office of Land Use and Climate Innovation. So in speaking with these 3 tribal partners plus other tribes in the region, priorities that came up for them for climate change and climate resilience, improving air monitoring capacity was really a main priority, especially because wildfires and wildfire smoke are a large concern in this region. Yet because it's really rural, there's very few regulatory air monitors. And so it's really difficult for communities to know locally what their air quality is or how to take action accordingly. But in addition to wildfire smoke, there's other ongoing air quality concerns related to indoor air quality during cultural or prescribed burns, and air quality related to sort of nearby polluting sources. And we heard from tribes that some of them had actually received these purple air particulate matter monitors, which I think folks are quite familiar with now, from air districts where, but were never really trained to use them, and maybe didn't even have access to know how to register them, didn't know which email address was used. So the key focus of this component was really building capacity among tribes to collect and use their own air monitoring data. And we also have some activities related to building tribal capacity and assessing their needs related to drought mitigation. Next slide. I'm just see that I have 5 minutes left, so keep going. So a key activity of this workshop was to have a workshop on how to use purple air sensors, which we held this past spring with 13 tribes in Middletown. So the picture on the left is some of our co-location of monitors just to make sure they're all working. And on the right are pictures from the workshop. So we really had a hands-on training to use these monitors that the participants would then be taking home with them. We had some good feedback from the participants that they felt like they received everything they needed to know to begin air monitoring. And so now the individual tribes are installing the air monitors based on their own priorities. All tribes have at least one outdoor fixed monitor. Some are doing indoor air quality monitoring. Some have installed them inside and outside of their casinos and in homes. So the rest of this project, which ends next February, is really to focus on building capacity to access, understand, and use the data. Next slides. Thank you, Jackie. Perfect. Okay, so as Jackie mentioned, we have this project called Charm Lake County. So this was a planning project funded by the NIH that really came about. It was an opportunity to really understand what issues related to climate resilience were happening in vulnerable communities in Lake County. And so Sarah at Big Valley was saying that there's, tribes play a really strong role in their county in responding during emergency events. However, there's not that much coordination with the county. And in fact, it was county agencies were like, you do your thing, we'll do our thing. And this was an opportunity to convene this diverse working group of tribes, local government, NGOs, community advocates. We had some state folks on board to kind of learn more about how extreme heat and harmful algal blooms and other climate events impact Lake County. And from this, we would develop a plan. Next slide. So what we did was a lot of different types of data collection to really understand how who are the vulnerable communities and how are they impacted. So we had an online survey. We did 65 interviews with participants that our working group had identified as sort of priority groups. So that would include tribal communities, outdoor workers, seniors, people with disabilities, unhoused folks, people who live in mobile homes, just a wealth of folks. And we really found that there were many individuals who belong to multiple sort of vulnerable groups. We had working group meetings to um, have our get input and guidance on how we were collecting this information, and it resulted in sort of the synthesis of this information is in our roadmap to resilience. Next slide, which you all can see here, but was our way of trying to share data collected from the surveys, data collected from and quotes from those interviews to really shine the light on people's experience from, and it's sort of organized by like vulnerable communities, climate-driven events, and some of our strategies. And so I encourage you to check it out. Next slide. And so we actually got phase 2 funding, which was amazing, from NIH to continue this work under the title of emergency response and preparedness. So, which is great. And so it is, because it's NIH, it's really research heavy, but the idea is that we want to develop or co-develop with our community partners and tribal partners a community adaptation and resilience intervention. And all the research stuff around it is to kind of assess whether or not that makes an impact on participants during extreme heat and other climate-driven events. Next slide. So basically, what we're doing right now is working with our partners to develop this carry, and it's going to be sort of a 3-pronged approach. We would have the idea is that we would really want to center this in spaces that are trusted by the community, and they may not be sort of formal resilient centers, but places that we know that folks already naturally go to during heat, heat emergencies or wildfires or others. And so the intervention will be workshops, one-on-one sessions to help folks get signed up with resources such as alerts or low-cost energy assistance, and then also providing a heat resilience kit. And the last slide, I think for me, is just sort of acknowledging our great project collaborators. And I think that's it for me. Jackie, do we have like one more slide? I'll hand it over to you.
We do, and I'll just leave these up here as we kind of open it up to questions, so or thoughts on what we just presented on, but just generally like wanting to hear from everyone what some of the current climate and health data needs are and kind of what some of the challenge you've experienced, in presented data by tribal jurisdictions. So, or just any questions you have on what we've presented.
Well, thank you so much for all of that, and it's amazing to hear more about your work. I've got lots of questions, but I want to leave it open to the crowd. Can I ask, as you're seeking input, is that for the tracking tool, the Explorer?
I mean, it's kind of general. We are kind of thinking about where we're going to be moving in the future, how to build out our program, what we can do with the data we have, and where, or maybe new data sources. So just general feedback, but also if you have something specific about the Explorer, we'd love to hear that as well.
Um, yeah, sometimes what we like to do in these meetings is just go into that Explorer and kind of tinker around, like what would it look like for Paula, who, leads our initiative, like Paula were to approach that. Like, let's look at it through that lens. And we end up stumbling over certain issues. So we could do that. That might be a good use of time. You already brought up a lot of the things that we talk about in these meetings, a whole lot, including, the boundary and the scrubbing or the anonymity of the data when it gets to a certain scale. And then just the data sets themselves, like your tracker has some really good stuff. I really love the visualizations, like really amazing. I think what Sarah was mentioning is an issue that we've come across a lot. How do you help tribes make decisions? So the Tracking California tool doesn't exactly look like it's solely related to just helping tribes make adaptation related decisions, but we have pointed to it, right, Lori, in some of our tools. We point to Tracking California. Where basically, we're on the hunt always for what's the most accessible, useful, meaningful data, ideally really well visualized, pre-calculated, has a nice narrative attached to it. Somebody at a tribe could grab it, pull it, and use it in a report or a presentation. And so I feel like your visualizations are really good. And there's just a ton of data, right? There's a ton of data that we're always looking for. And we hunt and peck around for different places to find it. But I would like to share with you, if you haven't already seen it, our tool, and it's sort of open source. We're just saying, here's what we know that tribes need when it comes to tribal resilience data. And it's an enormous inventory and data set of indicators with sometimes we have good data sets attached to them and sometimes we don't, or like accessible data sources. So you're welcome to look at that if you're looking for like a repository of a wish list of data.
So these are tools that are kind of, or data sets that you guys would theoretically love to see kind of visualized or incorporated into some other type of
Some of those
ECBs
are
format.
visualized.
Yeah.
It's just, hang on, somebody is pounding at my door.
I think she's gonna say it's basically it's like a go-to. It's a one-stop. Start here and then go to all these different, a billion different data sources and tools to go find all the different sets if they exist. And so we're always just looking for the best we could get. Sarah.
I wasn't even aware of this work group and this organization and this, tool before a couple days ago. So this is amazing what you've shared. What I would like to do is kind of play with some of these, or have my team play with these tools. And we might be able, so we're looking obviously at weather, climate, flood related data sets, but we're also looking at resilience and preparedness data sets. And I imagine you guys are looking at the same data sets that we are, but maybe we can play around with your tool, and if we see something that maybe has not been incorporated, we could suggest it. But I'm very excited to start looking through this.
Thank you. Shubhayu.
So, just a quick question, I guess, Angie. I mean, there's so many different data sources, information sources, let's say, for us to look at local temperature profiles, right? It's something that Sarah brings up as well. And, is there a tool which has been specifically designed for tribal jurisdictions? The repository is, this is across the board, right? So there's so much of CDC data available, which really, doesn't quite delineate, the tribal jurisdictions. It's still at sort of county level. And so, let's say for the state of California, is there anything which shows any of these exposures, the climate sensitive exposures, specifically sort of, with the tribal delineations, with the tribal jurisdictions?
That's
Well,
something
that's
I'm sorry.
was that for me? I think, Sarah, if you know too, for us, we know like our tool is an Excel tool and it's not as easy as we wish a tool called Easy was. So, but we, that was as far as I could take it. Now we've got our HPI friends who have web developers and web-based tools to build off of. So we are building a lot of this information into that. Not all of it. Right now we're starting with extreme heat, but doing it in a way that's looking like a decision tool. But, if I'm thinking of this as like, hey, free market, we need more people providing more support. There's probably some things that you all could do that are not being incorporated there. And we could talk more about that. Like, I really like how you're projecting a lot of the health related data. And I feel like that's, I don't know. I think we could look at like, where's the remaining gaps? And maybe you should, it would be great if you could come next time where we're talking about what we learned from NOAA, about what the tribes are asking for that doesn't exist yet. And then this conversation we're going to continue to be having around wildfire health, which is like a lot of air quality. It's it's trying to get down to more episodic health related data relevant to wildfire events rather than just like a generic PM 2.5 value, which is really hard to make effective climate related decisions about. So that, and then water supply. So we're going to be diving in there, and I really think there's a lot of work to do to make that data more accessible. Right now it's a black spot. It's a blind spot. Anyone else?
I'd like to add about the visualizing with tribal boundaries, that causes some problems. A lot of tribes would like to see their historic lands as well as their current lands. And then tribes that have both fee and non-fee lands, the fee lands are sometimes easier to visualize, easier to get data on. And so it's tricky.
Yeah, I think there's some questions about like what's possible to have on a public facing Explorer versus what's possible to help and partner with, an
Exactly.
organization with to do on a case by case basis
So,
for those
if you
reasons.
look at yeah, Jackie, if you look at the dashboard that Sarah shared, it's basically using HCI data for the San Diego County, but specifically, I think, extracting the information for, tribes and American Indians and such. And so, our program, because of the close relationships that we have with California Department of Health, we would have access to that statewide database, and so something like that can be created for the entire state. But, we would rely on you for, for the utility of something like that. It still wouldn't answer your question, Angie, as to, can somebody from the Pala tribe go and use that information, or is that information useful? If so, in what way? We would look towards you for that motivation and for that rationale for them to, figure out then, okay, how can we go about doing that?
Yeah, well, that's super useful just to know that you all are out there trying to make more tools that are accessible to tribes, and you do a really good job of doing it. So as we come across gaps and needs, you're another resource to point ideas to. Would love to. Well, I want to thank you all for coming. Thank you, Tracking California. Stay in touch. We would love to have you continue to participate in this group because we're always hearing about new tools and opportunities and all pointing in the same direction of trying to make this data more accessible to tribes so they can protect themselves from the impacts of climate change. So we're all kindred spirits, and I love spending an hour nerding out with you all for an hour or so.
See you
All
again
right.
November 13th.
That's right. All right. Take care,
Thank
everybody.
you. Bye.